All right, and it looks like we have a few of our attendees trickling in here. So thank you to everybody who is logged in and joining us today. We are grateful to have for our third round in this series of webinars hosted by the Carolinas chapter, Dr. John Weiner and Dr. Maryellen Kelly, both with Duke. Today, really focusing in on sexual health for teenage females. We do want to make sure that this is an interactive session for everybody who's here with us today. So if you are at a computer, there is a little Q&A button at the bottom of your screen. So feel free at any point, even starting now or at any point during the presentation today, to drop any questions that you have in that question box. There is an answer to make to submit those questions anonymously. So if you'd rather we don't see your name, feel free to submit any questions anonymously, and we will do our best to get through all that we can. I guess I'll go ahead and turn it over to you then, Maryellen, and we can get things going.
All right. Hi, everybody. I hope everybody is on a comfy couch. It would be nice if we were all on comfy couches together. It'd make for a much easier conversation, I feel like, about sex and puberty, but this will be fun nevertheless. So as Christy said, please, let's make this interactive. Even though we don't hear you or see you, you can still ask questions, put them in the comments there in the Q&A. Feel free to anonymize yourself if you'd like. And this way we can make it a conversation, because you don't want to just hear me blabber on about what I think is important. I want to know what you guys want to know. So as Christy said, I'm Maryellen Kelly. I'm at Duke. I'm a nurse practitioner there in pediatric urology. And I've been working in Spina Bifida for 10 years. So hopefully that qualifies me to talk to you guys, as well as the fact that I am a female. And I went through puberty. I have 2 kids of my own, and I feel like it hasn't been that long since I was in 7th grade, and that was my least favorite grade. It's been longer than I probably care to admit, but hopefully I can help you guys through some of this. And the other thing I just want to kind of start us off with is just making sure everybody knows, I really want to kind of stress that we're all sexual beings, and sex and your sexuality is super important, not just to you and your family, but to your healthcare providers too. So we're all here to help you guys and make sure that you guys have the right information so that you feel super confident, not just about yourself, but about your body and what makes your body potentially a bit more unique than someone else's without spina bifida. So please shoot your questions my way, and we'll kind of just start talking through. And Laura just says she has a million questions. So good, you'll keep us busy. I guess the first thing I was going to start with is just kind of basic female anatomy. I just want to kind of clear the waters there and let you guys know that people with spina bifida and without, generally speaking, your female anatomy is the exact same as somebody without spina bifida. So unless you've been told otherwise, which would be rather not very common, you should have 2 ovaries, you should have a uterus, you should have a vagina. Then on the outside, you've got your clitoris, your labia, your urethra, and your poop hole or your rectum. So all of that should be the same. There's no really huge difference as far as your basic anatomy if you have spina bifida or not. And to be honest, you actually probably know your anatomy way better than somebody who hasn't, especially if you have done intermittent catheterizations or enemas or anything like that, because you're probably have just been more acquainted with your anatomy for a lot longer than most other girls. So you might actually be the one in your friend group who can explain things to everybody else when they have questions. And this is being recorded. Yes. Yeah, this is being recorded, Laura. All right, so after that, I guess we'll jump in and talk about puberty for a little bit. So puberty starts on average in most kids, most girls, between the ages of 7 and 13. And once it begins, you got about 4 years of fun ahead of you to finish it out. And in individuals with spina bifida who also have hydrocephalus, so if you have like a BP shunt, etc., and that does tend to be a little bit swayed younger. So it's a little bit more common if you have spina bifida and a shunt to start puberty before the age of 7, which is, they call it precocious puberty, just means kind of early onset puberty. But otherwise, if you don't have hydrocephalus with your spina bifida, kind of the timing that you're going to go through puberty should be the same as everybody else. So again, that's about ages 7 to 13 is when that begins. It starts with breast development. So you kind of get the little breast buds. Takes about 3 years total for your boobs to grow and be their final state. And normally after you start to see breast buds, you will get your period about 2.5 years after that. So that's around, on average, age 12 and a half years of age is when you first get your period. And again, that's not everybody. That's just sort of the average. I was almost 17, so I was way on the other side. So there's a whole skew of what's still normal, but that's just so you can kind of expect it. I think one question that I see in clinic a lot from girls and moms and sometimes dads who just looked scared is, what do we do when somebody has their period and they are cathing, or you've got diapers or pads or pull-ups already, and they just seem like it's very overwhelming? So obviously, if you already have your period and you're listening to this and you've gotten a great idea, feel free to throw that down in the Q&A too, so we can share with everybody else. But I think it would be good to hear what you guys are doing rather than just what I tell people. So if you get your period and you do catheterizations, or somebody else helps you with catheterizations for your bladder, that can be fine. You don't need to stop cathing. You don't need to cath less or more, etc., just because you have your period that time. It could be potentially messier because obviously you have blood and everything that could be going on, but that doesn't mean that you have to cath on a different basis. And the same is sort of true with what other products you might be using as far as for any kind of urine or bowel incontinence. So if you leak pee or leak poop and we're wearing pads, pull-ups, diapers, you might need to change them a bit more if you're having kind of a heavy flow that day, but that shouldn't interrupt kind of the schedule that you need to empty your bladder. I will add though, oftentimes females, again, regardless of spina bifida, if you have your period, you tend to have more active kind of bowels. So if you're on like a really good bowel regimen, maybe like a MACE or enema program or something, you may find that when you start getting your period, that you go through this cycle right around your period when your hormones change, where all of a sudden you're like, oh my gosh, I'm pooping away more, or I'm having more leakage. And that can be kind of normal. And that would definitely be something you can talk to your urologist or whoever's kind of providing your bowel or bladder, depending on the issue, care, because we can try to figure out ways to help you guys out there. Because that can definitely be an issue if you've otherwise been doing really well that we want to help mitigate. So guys, feel free to send some questions out so I'm not just talking at you. That's less fun for everybody. And Laura, you said you had a lot of questions. So the one thing with periods, and I guess keeping track of your urine, is if you are going to get like a urine analysis or something, so like a check for UTI, when you do that little pee sample, if you're catheterizing, probably not as big of a deal because the urine's coming straight from the bladder. But if for some reason you're doing like a voided sample or something where you're actually sitting on the toilet and trying to push some pee out into that cup, and you have a period active that day, it's important to let the nurse or whoever's ordering that sample or getting that sample from you know that. So that way, if they see blood in your pee, it's probably just blood from your period, not necessarily from your bladder. So that's an important piece of information to let people know. No questions on, so that's kind of my briefing on puberty, if anybody has anything they want to add. Next is, I kind of wanted to maybe move us towards how would you talk to your provider about some of these potentially uncomfortable topics. I mean, I know as a kid, I didn't like even talking to my parents about it. talk to my sister, but that was kind of it. So it's sometimes hard to identify that person that you feel really comfortable, not just being vulnerable and talking to, but also that you feel like has the right information. So it's important to keep that in mind. Find a provider if you can that you've known a long time or you feel comfortable with. You don't need to have known them long as you feel like you're getting along, and just ask them. So, health providers are supposed to talk about sex and pee and poop and feel pretty comfortable with it. And especially like your pediatrician or a developmental pediatrician, urologist, all of that, GI, of course, especially those specialties, like all we do is talk about pee, poop, and sex. Like literally that's all we do. So feel free to kind of just blurt it out and ask questions, or if it's too much to just kind of come out with a question, you can always say, ask the provider, is it okay if I talk to you about a question I have about sex or my periods or whatnot? So that way you're kind of throwing it out there, kind of testing the waters, and see how they respond. And if they're like, yeah, let's chat, hopefully that'll help you and you can just have those conversations, because it's important to ask people questions when you have them, so you guys have real information. All right, I got some questions. With periods, I know they are different flows, different lengths, etc. for everybody. But if your periods are irregular, can we control it with hormones or birth control? And are there risks with spina bifida and birth control as low as age 12? Okay. So don't erase that question on me yet, Christy. Let me reference it. So yes, everybody's flow is different. So on average, most periods will last about 3 to 7 days. I think the mean there is about 5 days. Some people will have really heavy flows. Some will have very light flows. And honestly, you might not even have the same every month. I know I mentioned the average age to get your period is about 12 and a half, but it takes about 2 years for that really to get on a regular schedule. So you might get one at 12 and then not again for like 3 months. And that's okay. That's pretty normal. So, if it's not super bothersome to you, then kind of try to let your body be as it is and let those hormones do what they're supposed to do, get you through puberty and have some normal periods, and let it get to a stable spot where you're in a predictable pattern. That said, if for whatever reason your periods are really heavy, you're having really bad cramps, you're sexually active, whatever it is, and you want to do birth control, then that's definitely something that you can do. So there are, generally speaking, you can totally use your birth controls. They have implantable ones now. There's implantable ones. You can get the, what am I thinking of? The OCPs, they call them, the pill that you notoriously take every day. There's the ones they put in your arm. There's injections. There's a lot of different types of birth control that are now out there that you can use. So I'm totally sorry, Laura. Let me go back to my question. Are there risks with spina bifida birth control? So there's not really an increased risk. If you're on anti-epileptic medications, so if you also have seizures or something, that might be a risk for some different hormone contraceptives. So that would be something you'd want to bring up. But it would really just be that kind of association. Otherwise, no problem. Go ahead, get on birth control if you would like to. The one other piece is, we know especially as kids get older and into adulthood, just in spina bifida in general, osteoporosis is a bit more common, especially in females, especially in white females. And now you have white females with spina bifida. So that being said, you don't want to overly suppress estrogen because that's a protective factor if you don't have to. So something to also just consider. Okay, another question. Is it normal to have more urine output around the time of your period? I noticed that some months there's more output compared to what is normal. Like I said with poop, you can definitely have just kind of a variation. As far as actual volume, it's probably not a big difference, I wouldn't think, but you might be getting more frequent voiding. because you kind of just have some more movement that's occurring within your body. So you have a hormone change, and then there's actually more contractions and such. So you might be getting more frequent voiding that's coming out, or your daughter or yourself might be drinking a lot more water because that's going to help with a lot of period cramps, headaches, things that are pretty normal when you get your period. So you might be seeing some output secondary to that as well. All right, another one, independent maintenance of heavy flow days is more the concern. Okay. So Laura, I think you mean if someone's having a really heavy flow, you want to know if that's better for the pill or a contraceptive, or is it how to manage a heavy flow day as far as like cathing and pull-up diapers? I'll see if we get an answer right back. I can start trying to answer that. So if it's management of heavy flow, so some girls get really heavy periods and it's like constant cramping and they're just miserable. They like pass a lot of blood and they're just uncomfortable. If that's why you want to start some sort of hormone regimen to diminish that, then that's fine. If you want to really talk more about maintenance of heavy flow days as far as the logistical maintenance, then the logistical maintenance part would be just probably changing a pad or changing a pull-up more frequently. Since we're talking about periods, I don't think I mentioned tampons. So a lot of girls want to eventually use tampons and not pads. That's fine. That's totally something you can do. There's really, once you're ready and you know how and you want to, then a tampon can totally be used to help manage your periods. Especially girls who are in pull-ups or pads for pee, sometimes that's really useful because then it kind of keeps it separate a little bit. So the blood from your period will stay on the tampon and not be leaking, or hopefully not as much leaking into your pad where your urine is. Okay, Laura added, yes, changing her pad diaper herself, and it's literally running out. Without being able to weight bear, potentially it's tough to change it without getting everywhere. Yeah, so the logistical aspect seems to be the question there. And that is hard. So some people will also put potentially like a pad inside of a pull-up. So you kind of have a dual barrier there, and that can be helpful. And you can, if you're comfortable or your daughter is comfortable, you can always try to get somebody to help as well with the change if it's going to be too complicated to try to do yourself while standing. They also, depending on sort of how much urine is being leaked out compared to how much blood there is from your period, they do make, and I haven't actually tried them myself, so I don't know how well they work, but from people I know, they say they work really well. There are like the absorbent underwears and such, so you could almost wear that first if you'd like. They're like the period underwear. I think it's made by like I Think or so. There's probably a few out there. But you could wear like a period underwear and then maybe your pull-up, because the period underwear isn't going to hold quite as much fluid, but it could be something you might want to try to experiment with a bit. And they do make other devices too, like menstruation cups. They're like little silicone cups that you can insert into the vagina, and that helps to hold the blood there so it's not leaking out as well. So a couple different things you could play with. Okay. So, all right, let's move through. Make sure I'm not missing anything really big I wanted to make sure we hit on. Kind of talking about 12 and a half year olds. The HPV vaccine is out there, and that's a pretty common vaccination that's now offered. They start offering it, I think, now down as young as 9 years of age, kind of before puberty in most children, for boys and girls. But in girls in particular, HPV, it really helps to get rid of not just the potential for STD, a certain STD, but it also can help to reduce your risk of some female cancers. So once that's kind of something that's an option for your child or you, we would recommend that you go ahead and try to get the HPV if you can. All right, I'm moving on to good stuff. Okay, let's talk a bit about fertility, because I think that's something, and it's something that from the adults with spina bifida that we have talked to and done research with, that they keep saying nobody talks to them about, and it's super important. So your rates for fertility for females with spina bifida are really the same as females in the general population. So your ability to carry a child and have a child is great if you so wish to do that. And if you want to be a mom, we can, you can talk to your gynecologist if you have one. If you have a gynecologist who's not very comfortable with spina bifida, feel free to ask someone in your spina bifida team, like your urologist or whatnot, to try to refer you to someone who is. Usually most centers will have the resources to give you a gynecologist that's more familiar with spina bifida patients. But so if you want to be a mom out there, I'm sure you're going to be a fantastic mother. So go ahead and go for it. We can definitely help you with that. So the one big thing with fertility is that spina bifida itself can be hereditary. It also, you are an elevated risk, therefore, as potentially being the mom, to kind of pass some spina bifida on to an offspring. So if you are contemplating pregnancy or actively planning pregnancy or potentially could even become pregnant, it would be a really good idea to start on folic acid. And that's something that is in most like over-the-counter prenatal vitamins. But if you yourself have spina bifida, it's recommended that you take a much higher dose. So your dose should be 4 milligrams of folic acid. And ideally, you really want that on board and in your body for like a minimum of a month, but really 3 months before you get pregnant. Because spina bifida occurs really early in pregnancy and usually occurs before you even know that you're pregnant. So having that folic acid kind of in your diet, usually you can get a prescription for that level of folic acid or get a supplement that's that high in your body already. And you want to take it throughout the whole first trimester. So that's the first 12 weeks while you're pregnant as well. And it's just important to know that most of the over-the-counter prenatal vitamins out there, the amount of folic acid in those is pretty small. It's like 600 to 800 micrograms. And so you're looking to find something that has 4 milligrams every day. Great question came in, and I'm so excited because that's totally on my list of things we need to talk about. And that's, are there things we need to know about having sex that might be different? Yeah. So great question. And this is where knowing your body is going to be super important as you move forward. So one is, a lot of females note that their pelvic floor just doesn't have as much sensation as somebody that doesn't have spina bifida or any kind of spinal cord injury, etc. So you might not have as much sensation like in your clitoris or in your labia or in your vagina, the typical kind of erogenous or sexy zones, whatever, that people talk about. So you can figure that out yourself at home if you'd like, or with your partner, that's fine too. But if you find that you don't have great pelvic sensation, and even if you do have good pelvic sensation, you may find that you have heightened sensation in other spots. And that's a really common thing that we hear from both men and women with spina bifida, that, yeah, maybe my clitoris or my vagina, like I feel it, but it's not like what totally turns me on. But instead, maybe my earlobes or my lips or my nipples, chest, my arms, those are all really common areas that females with spina bifida, adult females too, report feeling much more sensation. So, I mean, kind of experiment with your own body and see what you find kind of turns you on and makes you feel good. And knowing that is really important. So when you have a partner, you can communicate that to them. Because if it's somebody who hasn't maybe been with somebody who has spina bifida or other disabilities, etc., then you might need to just tell them, be like, yeah, that doesn't really do it for me, but this does. And most partners, if they're they're worth your salt, are gonna be more than happy to kind of turn you on how you need to be. The other thing that you might find is different is positioning. So a lot of people with spina bifida, you guys might have hip issues or spine issues, etc. Maybe bad scoliosis, or you've had rods or something in your back where it's just really uncomfortable in a certain position. So for a lot of people, I feel like when you think about sex in the sense of just like intercourse, something going in the vagina, you think about like laying flat on your back or something, and that might not be an okay position for you. And that's totally fine. So you just need to find a position that you find more comfort in. So whether it's, sitting upright or laying on your belly or whatnot, finding something where you're comfortable. You don't want to be uncomfortable when you're having sex with somebody you want to be having sex with. That's not fun for you. And that won't be fun for them either if you're uncomfortable. So position, we got that. Lubrication's another one. So a lot of females with spina bifida, they notice that they just don't have as much self-lubrication down there. And to be honest, across the general population, I think I was reading last night on some of this stuff, and it's like 70% of females report that they don't have enough lubrication. So you're not alone in this. It's pretty common, but it's a bit more documented in people with spina bifida that they may need external lube. So use as much lube as you want. There's different ones. There's oil-based, there's water-based, there's silicone-based. That's all very important. They all work really well. So go ahead and kind of see which one you like. The big differences are really just kind of how frequent you'd need to reapply. The silicone-based lubricants, just as an FYI, if you use those and you are using like a sex toy that's a silicone-based sex toy, that sometimes can break down that silicone. So you may want to use a different type of lubricant. Condoms, talking about sex. Quick note on condoms. As you guys know, with spina bifida, you have a higher risk of latex sensitivities and latex allergies, and most condoms are latex based. So be aware of that if you're out shopping or if your partner is buying condoms, or whatnot, that you need to avoid latex condoms. There are lots of brands out there now that make non-latex versions. You just need to look. Even Trojan makes non-latex condoms now. I think they call them Bearskin, B-A-R-E. And then Skins, S-K-Y-N, Skin brand is a whole brand that's all non-latex. So you can find them at most Targets, etc., CVS, but of course online too. So just be aware of that. The other big piece about sex is continence. So continence keeps coming back as a problem. So adults with spina bifida who are sexually active report that they have issues sometimes during sex having more leakage of either stool or bowels or their poop. So planning for sex sometimes becomes a bit more important, and that's not always super fun. Sometimes you just want it to be spontaneous, but if it bothers you that you leak a little bit during sex, then you might want to become a bit more of a planner in regards to it. So usually emptying your bladder, whether that's if you pee on your own volitionally, it's doing that, or if it's using a catheter beforehand, go ahead and empty your bladder as completely as you can before a sexual encounter, to just make sure there's not much urine in there, and therefore you're going to be less likely with stimulation to leak. Same thing with your bowels. So if you tend to be pretty constipated, some people will find that intercourse or even just stimulation down there, that can cause you to leak. Same thing can happen if you're somebody who tends to have has a more weak sphincter outlet there at the rectum, that you might have more leakage. So if you have a bowel regimen that works pretty well, or a way that you can poop regularly, like an enema or whatnot, go ahead and use that before your date or whatever you're expecting, to try to help prevent an issue. And while we're on that note, And feel free to keep writing questions. So far, these have been really good. But on that note, it's really important, I think, for all females, but I'm going to stress it for those with spina bifida, that you really communicate kind of your needs and expectations with any partners you end up having, because your body is a little different. You know, it's not largely different. Like I said, you've got the right body parts, you can have babies, you can have sex, all that stuff if you want to. But like you said, your sensation might be different. You might need more lubrication. A certain position that somebody's used to just might not fly for you. So, or you might leak a little pee or something. And I mean, that's not always a big deal. So, and all these things aren't always huge deals. They're not necessarily make or break things. It doesn't mean you can't have a boyfriend or a girlfriend or partners or anything. It just means you might need to talk to them a little more. And most partners are totally willing to have these conversations with you, and they want you to feel good. You know, they always say confidence is the number one turn on or whatnot, or it's like the thing that makes people the sexiest is their confidence. And it's not really a lie. If you feel confident when you're in there and you're like, yeah, this is what my body does, this is how I'm going to feel good and whatnot, really communicating that's going to be big, and finding someone who's willing to really be intimate with you in that way is probably going to give you the best long-term satisfaction. So it's important to have those conversations and just feel comfortable. And if you don't feel comfortable, practice. You know, do a Zoom with yourself. You know, practice saying these things. Talk to your healthcare providers if you want. If you have one you feel comfortable with, and that's really good. The other piece, which I definitely wanted to get to, is sexual abuse. So intimate partner violence, and I know you guys probably have heard that term, sexual abuse. That's common across the population as well, in males and females, but we do see a higher rate of this in individuals with spina bifida. So that's not to scare anybody or to scare any parents who might be listening in, but it's important to be aware of, because if you are, again, needing catheterizations or bowel programs or diaper changes or anything where you've been having to trust other people, whether it's your parents or nurses or aides, aunts, uncles, whomever it is, they're really up in your business, right? Like they could be up there kind of separating your labia, inserting catheters, etc. That's a really intimate thing that someone conceivably is helping you with or has helped you with multiple times a day for possibly your whole life. So it's important that you feel comfortable with whoever is helping you if you need help. And if you ever don't feel comfortable, then you always can say no. Just stop, tell the person to stop, no, go away, you know, have a backup plan, have somebody you can call, a way you can get out of that situation. And that's not just for cathing or bowel programs, that's for everything. So, you know, if you find that you're just in an uncomfortable situation, whether it's a planned kind of sexual thing or it was not planned sexual and it feels like it's going that way, say no, stop. You know, all those big words everybody knows, and try to remove yourself from the situation, get out of the situation, ask for help after, make sure people know what's going on and can help you, okay? Or, you know, thankfully we have cell phones now, so you can probably call somebody to come help you, whether it's a friend or a parent or someone. But there is this increased risk of sexual abuse, so we want to be proactive about that, okay? Any more questions? All righty, let's go. Let's see. I want to make sure I'm not missing anything too big. Oh, talk about Pap smears for a second. Because I know we talked for a moment about gynecologists and making sure you find one that's pretty comfortable with dealing with spina bifida. It's also, you need your routine PAPs. The guidelines for those keep changing, but for now, they're supposed to be, I think, every 3 years once you're 21 years of age, if they're always normal. If you have an abnormal Pap smear, then you'd have to change that. But again, given spina bifida, you may find that the typical bed that's in a gynecologist's room, it's not going to work. So you just need to make sure that your gynecologist can kind of accommodate that, so that they have a exam table. If you're in a wheelchair or whatnot, have limited mobility where it's hard to climb up onto a big bed, you might need to make sure they have one that's like a stretcher that goes, low to high. Being in stirrups, just when you have your legs kind of up and spread so they can examine everything. That's something too that, just like we were talking about sex positions, laying on your back or in that position might not work or might be so uncomfortable, and you don't want to be tense while you're up there in stirrups and someone's trying to kind of look in there. You don't need that. You want to be as relaxed as is possible. So talking to your gynecologist about, oh, that position's not going to work. Can I do this? Or ask them what they would suggest if you can't lie flat on your back or something, would be really important, just so that you're not uncomfortable. Okay. And that's, again, just empower yourself there on that. Okay. Sorry. I did make myself notes, so I didn't miss anything really big in case. Cool. All right, I'm going to talk a bit about pregnancy since we've talked about sex, and we talked about fertility. So again, fertility rates are the same in spina bifida and non-spina bifida, but pregnancy, you are at an increased risk of having a C-section. So in the non-spina bifida population of females who have babies in the United States, about 30% of them have a C-section, but in individuals with spina bifida, it's just over 50% end up having C-sections. And you have an increased rate of C-sections. I think the highest rate was about 65% of pregnancies resulted in a C-section, if you have hydrocephalus as well. So it's directly related to that as well. So if you have a really low level lesion, or like a spina bifida occulta, or like a lumbar, or just a sacral level spina bifida, so a lower level, you do have a higher chance of having a vaginal delivery over a C-section. And the higher the level, and then if you have hydrocephalus, you have an increased chance of a C-section. One of the things you'd want to discuss with your obstetrician or your high-risk maternal fetal medicine doctor and your urologist would be kind of what's their recommendation for how you deliver, because it is going to depend a lot on you and your body and what surgeries or continence procedures you might have already had. So like if you had a bladder neck sling or something to help keep you continent, you might not want to deliver vaginally, because that could compromise some of that repair and make you less likely to be continent after you've had your baby. So that's just something you're going to want to talk to everybody who's involved with. That being said as well, if you're scheduling a C-section, so you're pregnant, planning to do a C-section for all the different reasons you could be planning to have a C-section, and again, talk to your urologist. Most urologists, if they can, they might want to be there, especially if you have had surgery. So if you've had a Mitrofanoff, which is, that channel you can catheterize through your abdomen, or a sling, like we said, like a bladder outlet procedure, a MACE, a bladder augment, any of these big bladder or bowel surgeries, the urologists, they're kind of protective people. And so they want to make sure that what the work they've done for you to help you with, whether it's, your kidneys or your bladder or just continence, that doesn't get kind of compromised during the delivery of a child. So making sure they're aware, see if you can coordinate that. If you're in, an academic center or whatnot, that's hopefully going to be an option for you. The other result we see is, when you look at statistics about births with those with spina bifida versus without, or moms who have spina bifida versus moms without, is most moms with spina bifida do tend to deliver at kind of bigger urban academic teaching hospitals. And that's likely because they kind of want that tag team approach. So you might want the urologist and a high-risk pregnancy provider, and maybe a NICU nearby in case the child does have spina bifida. So there's not as many people delivering who have spina bifida at kind of the rural hospital or birthing centers as there are at, the big academic institutes. So also with delivery, if you decide and you can deliver vaginally, the other thing that would be considered is if you do have a shunt for some reason, they usually will limit the amount of time that you can kind of be pushing your baby out. So you go through all the laboring, getting everything ready, and then eventually you gotta push the baby out. And so that actual time of kind of pushing the baby out can put pressure and kind of increase your pressure within the shunt. So usually they try to limit that, and whoever's helping to deliver should be aware of this. Again, good communication about everything is important, but they'll usually help you if you can't deliver the baby very quickly that way, with like a vacuum that they put on the baby's head to help pull them out, or forceps, or something to kind of get the baby out faster than if you're going to be pushing for hours or whatnot. Okay. And that's for your health. That's so that way you're not having issues with your shunt having increased pressures. Same with pregnancy, not so much delivery. We didn't really touch on is what can happen with your maintenance of kind of catheterizing when you're pregnant. So if you decide to get pregnant and you get pregnant, the baby obviously, just like in anybody else, moves your organs left, right, center. They just push them all out of the way, and they basically just take up all the space, and your poor bladder and everything else gets kind of shoved away to the side. So the baby sits on top of the bladder, and your bladder just gets pushed down. If you have, say, a matrophonoff that you're catheterizing through, sometimes that can be more difficult when you're pregnant, and especially as the baby gets bigger and bigger, and kind of your bladder gets lower and lower. Same thing from below. It may be more difficult to even catheterize through your meatus, your urethra there at the bottom, if you can't see. Some people need to be able to actually kind of use landmarks when they're looking to get the catheter in. And when you've got a baby in your belly and it's pretty big, it might be kind of hard to get down there and then to see. So you might find that it becomes a bit more difficult to catheterize yourself. And if that's the case, again, let your urologist know early, like as soon as you start noticing, oh, wow, this isn't quite as simple, but maybe I'm still getting it. Let us know, because we can work something out. And it may mean putting a catheter in and leaving it in, and changing it periodically, but at least then your bladder's empty and you'll be in a better state than not being able to go, or all of a sudden not being able to get a catheter in at all. Same thing with a MACE. So if you have a MACE or kind of an antegrade continence enema of some sort, so you're cleaning out your bowels from the top, some people will have difficulty doing that as well when they're pregnant. The rates of having difficulty with that are less than somebody having problems with catheterizing their bladder. So it's usually easier to keep up with the poop program than it is the pee, but something also to just kind of be aware of and potentially be ready for. Guys, please keep asking questions. You don't want to just hear me drone on about, again, what I think is important, because who am I? Let's think, other things. Pelvic organ prolapse. So this is something that can happen to females at any age. It's essentially, if you think about your body, so you've got your vagina, right? And then you've got your uterus, and then the outside of your body. And basically your uterus and everything starts to kind of slide in through to your vagina, and eventually can actually slide out and kind of protrude outside your body. So there's different stages to that. It doesn't mean that your entire, girl organs are going to be falling out of your body, anything like that. It's just there's stages to it, but it does tend to be more common in females with spina bifida, and even in females with spina bifida who have never had children. So again, in the non-spina bifida population, pelvic organ prolapse happens a decent amount to some degree, but it tends to be a lot more common in older women and women who have had multiple children. But in the spina bifida group, we'll see it kind of across all ages, and in females that have never had any children. So that's just something to be aware of, because again, depending on your sensation down there, and if you have to cath or whatnot, you might not realize that that's happening. So that's just something that usually your urologist or again, your gynecologist will be assessing and looking for. But if you're ever kind of feeling down there and you feel something that doesn't feel right, feel free to please get it checked out. Okay. That's not something that's you should be ashamed of or anything. It's actually decently common. I want to touch back on something I mentioned really quick because I feel like it just needs to be highlighted more. And that's just really kind of what is going to make you feel sexy. And sexy is such a weird word, but it's the right thing. What makes you feel good? What makes you feel confident? Like, yeah, look at me, strut my stuff. That kind of sexy, because it really is just knowing, again, feeling confident about your body, but feeling confident that like your body is gonna do what you want it to do. You've experimented enough with yourself. You know what's gonna make you feel good. And honestly, GQ, Men's Health, all the dude literature out there in the media, etc. If you want to read that pool of literature, and also in the female stuff, it's really all about confidence. So, feeling confident about yourself, and not just the way your body looks and functions, but about you and your kind of, I don't know, yourself, right? Your whole inside, your self-esteem and everything. That's what makes you sexy to people. It's not that, oh, I can have sex this particular way and this turns me on. People don't really care about that very much, honestly. You want to be able to talk to your partner and feel very intimate with them in lots of different ways. It doesn't always mean having straight intercourse in the traditional manner. Like I mentioned, a lot of adults with spina bifida have been in long-standing relationships with their partners, and some of them report they don't have much intercourse, whether they're with a male or a female partner. They feel very intimate doing other things. So again, just finding kind of what makes you feel good, what turns you on, what makes you feel sexy, and being confident about it, that's going to be your biggest piece that's going to, I think, help you guys all out. Because again, sex is important, sexuality is important, and you guys are all sexual beings. We all are. So we want you to find what's good for you and be comfortable in that way. Okay, we got like 10 more minutes. So I can keep rambling. It's a skill, but I really would love to kind of hit on any other questions people have. So please feel free to pop some questions into the open questions. You guys have been silent for a while. And I'd love to know what I'm missing on while we're kind of wrapping up soon. Nothing yet. All righty. STDs? Since nobody's talking, I'll talk about STDs. So STDs are STI, sexually transmitted diseases, sexually transmitted infections. And these are going to happen at the same rate as somebody else who's having sex, if you're having sex. And again, sex can be anything. It can be straight, normal kind of intercourse that's penetrative, or it could be oral sex. There's so many things that kind of count. So it's, again, whatever you're defining. But STDs do occur at the same rate as everybody else. So you are not immune to any STDs. So make sure that if you feel like you may have had an encounter where you are at risk for an STD or STI, you talk to your gynecologist, urologist, even primary care. Usually can help you out and get you tested as needed. Okay. And yay, somebody sent a question. Okay. Did you say 21 is the appropriate age to start seeing a gynecologist? I did not quite, but you have good listening ears. So 21 is currently the age that it is now recommended to get your first Pap smear. And your Pap smear is just kind of a routine test where they're testing the cells on your cervix to look for abnormal cells. So, there could be things like cervical cancer or STDs, et cetera. They usually do that at the same time. That said, if you are sexually active before that, whatever age that is, then you probably want to talk to a gynecologist sooner. I usually tell my patients, and that if you're sexually active, it's probably worth at least establishing yourself with the gynecologist. It's nice to have that there in case you do have concerns about any kind of abnormal discharge or, bacterial vaginosis or STD, those kind of things. You're kind of already on their radar, and it'll be easier to establish with them. And they might find, if you have a lot of partners or whatnot, they might say, hey, let's get you tested earlier than sort of the average population. But 21 is the current age that a Pap smear is first recommended. Cool. Keep on coming. Oh, that was clearing. Okay, so, gosh, guys, no more questions? You guys know everything already. I'm so impressed. I'll go back to talking to your provider, because I know we got that as a question kind of before we started this webinar today. And I think it's a bit different based on if that question was coming from a patient themselves with spina bifida or from a mother or father or parent talking on behalf of their child. So for the parents who are out there listening or who watch this later, I think it's important that you know that starting, depending on your child, age 9, 10, 11, somewhere in there, that kind of pre-puberty, early puberty age, that hopefully somebody during the visit is asking you to leave the room so they can talk to your child by themselves. Of course, you need to be comfortable with that provider in order to say yes, but it's important to give your child time to kind of ask questions that maybe they don't feel totally comfortable asking you with some other trusted adult. I'd like to think that's me for my patients. It might not be, it could be somebody else, but you want to give the patient that chance. So if you have a provider, you're at a visit with your daughter or whatnot, and somebody says, okay, I'm going to examine them now and ask them some questions. Can you step out? Step out if you can. Give your kid a little privacy. We've all been teenagers before. Sometimes there's things you just want to talk to somebody else about, or honestly, they might just want another perspective. You might have a really good relationship with your child and you guys have talked about everything, but they just want to hear it from somebody else. So they might just be kind of testing your information to see if it sticks against the wall. So go ahead and give privacy and let them have that conversation. And you don't need to probe your child after, don't go back in after and be like, what did you just tell them? Because then your child's gonna be less likely to trust that provider in that relationship as well. Okay. And of course, if this was coming from a patient yourself and you're asking how to ask your providers, like I said before, feel free to throw a feeler question out just to kind of break the ice. Can I talk to you about sex or sexuality or my gender or something? And I think you're going to find most providers are totally happy to talk to you. They might just need you to push them if they're not pushing you. Okay, so feel free to ask. Got a couple, 4 more minutes. So again, get those questions in. Let's talk for a minute about, it's kind of about sex again, but that's what this whole day is about. So internet and porn. So again, this is not just for people with spina bifida, but across the population. People are watching porn. We all know that, or whatever kind of sexual stuff on TV, movies, internet, everything. And honestly, we're all home in quarantine, so people are probably watching more of it than normal. And just know that it's not real. So it's, it's a movie. It's animated or not animated. Well, it could be animated. It's scripted, I guess is the word I want. So it's scripted, it's actors, it's actresses, and it's not real. So kind of the whole intimacy in a porn is not the kind of intimacy that you will likely experience in real life. And frankly, I don't think you should. I think it should be a little better than that, where, it starts by, having a good relationship with your partner and wanting to do sexy things with them and feel good with them and whatnot. It's not what you see in the internet. It's not porn that's fake. And it's actually a problem we're seeing across the board in the population, especially with kind of teenagers and pre-teenagers thinking that that's actually what's expected of them the first time that they decide to have intercourse. And it's totally not. That's not a realistic expectation. So try, feel free to watch it. Enjoy if you want. It can make you feel really good. It can really turn you on, whatnot. And if so, share that again with your partner as something that you guys can do intimately together. But if you want to, just know that kind of the experiences you're seeing on those shows or movies or YouTubes are not necessarily what's expected in real life. You can come up with how you're going to feel best and you're going to feel most intimate with somebody else. The other thing, which I think is important and kind of goes along with that, is orgasms. So we talked about lubrication, we talked about positioning. Orgasms are not that common even in individuals without spina bifida. And that's just a fact that is good to know, because you might have friends or people who you hear talking about, oh, they had the greatest orgasm, blah, blah. Maybe they did, that's awesome. But some people fib about this a lot. They stretch the truth on these things a lot sometimes. So if you yourself don't feel like you're having an orgasm often or ever, that could be kind of normal. A lot of people don't have that. And again, you may have an altered pelvic sensation where it's harder to get kind of the typical orgasm from like clitoral or vaginal stimulation. And that causes a lot of women to orgasm. So just know that. And you may also find that in that same sense, you could orgasm from something different. So maybe nipple stimulation. And again, normal population without spina bifida also might orgasm from nipple stimulation. So it's so individual. But finding a way that you can still feel really good, even if you're not achieving a true orgasm by the, definition of the word. And again, maybe getting stimulated in a different way, in a different zone of your body is enough to kind of feel super good and still give you that feeling of kind of feeling sexy and having a good encounter with somebody. Also, I think it's good to know with orgasms that if you've had one once, it doesn't mean you're going to have one every time. And even if you're doing the same thing. So say earlobes really, like, it's a turn on for you, kind of maybe getting your earlobe licked or kissed or nibbled or something. Every time that happens, you might not orgasm. So that's okay. That's kind of normal expectations. So, there are days that we are all preoccupied, no matter how hard you try. You're with your partner and you're like, yeah, I really want to do something great here. You just can't get your mind there. It's just not going to happen. And that's okay. So try not to put that kind of stress and expectation on yourself. And same with your friends. Maybe you don't have spina bifida. Try to get that off of them too. It'll help us all. But just know that it's common to not have an orgasm. And if you feel like you're really struggling with that and you want to explore either new positions for sex or try to orgasm in different ways, there are sex therapists out there who are more like sexual physical therapists, and they usually will work with the adult population only, but they are wonderful. And they are definitely somebody who you can get referred to, you can look up, and a lot of them are really well equipped to talk to individuals who have spina bifida or other kind of disabilities or different sensations. So they might say, oh yeah, where do you have good sensation? Okay, your chest in general. Okay, here's something you might want to try. And the few individuals that I know that do this as their profession, one, they're just awesome people. And two, they make you feel super comfortable. But also they go to like the sex shops all the time and they know the products that are out there and they know what's going to work for different people. So they've done their homework, go ahead and ask them, and they might be able to really help you out so that you can feel satisfied, whether you're just at, with yourself and trying to have a sexual experience with yourself or with a partner involved as well. So there are resources out there that are well beyond me or Christy or anybody that you can kind of utilize and talk to and really make yourself feel good. And some of them too, if you have a partner and you guys want to go together, that's a really nice option and probably kind of a cool thing to do with a partner that you plan to be with for a while. All right, we're 2 minutes over. If you guys have any other big questions, feel free to email or email Christy and she can pass it along. It's kind of fun to talk about this topic. So I'm happy to keep talking to you guys about it down the road if you'd like, but this was a lot of fun. I hope you guys got some decent information from it. Yeah, Christy, we are 3 minutes over.
All good. Well, thank you very much, Maryellen, and thank you everybody who joined us today and who asked any questions. Like we said at the start, this session was recorded, so this will be available at the chapter website probably within a handful of days. And if you do have any other follow-up questions that we can help get answered for you, feel free to reach out to either one of us and I can make sure that we get you in touch with Maryellen or, work through our National Resource Center to help get you answers to any additional questions that you have. So thank you so much for being here today, and we'll get this published here soon. So thanks, Maryellen.
You're welcome. Bye, everyone. Have a good rest of the weekend. Day.